Hello, Dr. Edwin.
Thank you so much.
You're welcome.
Always privileged.
Now, it is worrisome that more medical practitioners keep seeking for greener pasture abroad. Should this be happening?
Well, I want to say no, because the lives of Nigerians matter, and the government of Nigeria, as well as the private sector, should begin to deliberately take actions that would keep our health workers within our borders. I'm sure you know very well that one of the 6 building blocks of WHO as it concerns reforming or building the health system is the health workforce. And Nigeria has to have at least 10 times the number of health workers it has presently for it to be able to meet the WHO requirement. That's a far cry from what we have right now. And every day, service delivery is going down, and we claim to be a country that is working towards universal health coverage. It's just like the two different sides of the road. So universal health coverage is this way, and then service delivery is going down. Health workers are leaving the country in the numbers, and nothing's been done to draw them back. Well, for me, one of the things which I would want to state immediately is the fact that the government of Nigeria has to begin to hold itself accountable. And of course, different state governments too have to play a very huge role in it. Our doctors are leaving, like you rightly said, because they want to have better lives, because they want to have good career progression. They want better pay. The environment where they work in, they want it to improve. Some of our hospitals are in the worst of cases, of course, and of course the primary health centers are not doing too good across the country. Initially, at the beginning of this tenure, the president said he was committed to revitalizing 10,000 primary health care centers. That has not really been done up till now. It's been put at the back burner. And so when the environment is not right, the pay is not right, the quality of life which they live and their families live, it's not right, there's that push to leave the country. And so we need to look into those things. And of course, Nigeria needs to discuss with the international community. There's kind of like a trade labor union and organization, the World Labor Union. We need to be discussing with them to see how we can really put a cap on the number of people who can leave Nigeria at every point in time to go to another country. That's not to say we should not appeal to the doctors to be more patriotic, but we must do what will keep them.
Now, what is the state of healthcare facilities across all levels of healthcare at the moment, be primary, secondary, and tertiary institutions right here in Nigeria? I know some people spend a lot of time, a lot of money just to study medicine.
Okay, so first I would want to say that primary health care, which is one of the foundations, the entry point to the health system, is the least attended to in the country right now. It's very, very obvious that most people, the triangle, in fact, the health pyramid has been inverted. So most people are supposed to go to primary health care because it's supposed to cater for over 80% of the population. Their diseases can be catered for at the primary health care level. But because they are not functional, you see people go to secondary facilities and even the tertiary institutions just to treat rashes, diarrhea, malaria. These are things that should be treated at the primary health care facility. There were hopes that the 10,000 primary health care revitalization would make them more functional and bring more people that way. But since that didn't scale through, we're more hopeful that full implementation, proper implementation of the Basic Healthcare Provision Fund, which has been signed into law and is now being put in the budget, it would help revitalize these primary healthcare centers and make things better. For the secondary, it's not a far cry. Different states in the country are going through various financial issues. Some of them are unable to pay salaries, which is one of the reasons why health workers are leaving the country. And at the same time, in spite of the fact that they are unable to pay, they're unable to invest in health because health does not generate the kind of revenue that would increase their IGR. Okay. So you see less investment in the health sector. And so you see the secondary health facilities may not be functioning as well as they should.
So
but
do you?
Of course, when you look at it generally, you see that there are some silos of improvements here and there. Like my state, Cross River State, there's been a lot of investment in primary health care. His Excellency Center Professor Ben Ayadi has done a lot to see how he can upgrade primary health centers and secondary
All right, so let's talk
facilities.
about health insurance coverage. That's another challenge in the country. How best can we actually cater for rural dwellers? They seem not to get enough attention as the ones in the city.
Okay, so first, government must be able to put its mouth where its heart is. So we must be able to consciously put out programs that are targeting rural dwellers. And one of the ways we can do this efficiently well is by ensuring that the entire health system is functional and the insurance is working. Nigeria as a country has less than 3% of its population being covered by any means, any form of insurance coverage. And we need to move away from that if we must achieve universal health coverage. So really, for me, I believe that first there should be an insurance cover for everybody, whether they can afford it or they cannot afford it. And Nigeria should subsidize care for those who cannot afford it. Both those in the formal and informal sector should put their monies together in a central pool, and we all share the risk and we all share the benefits.
Thank you very much, Dr. Betta Edu, the National Vice Chairman Forum of Primary Healthcare Agency CEOs. Thank you so much for your time.